What does it mean to a young child when either the parent isn't there physically or isn't there emotionally?
At birth, humans are biologically predisposed to bond to caregivers. And so there's nothing more threatening than when a caregiver is absent. And in terms of what absent is, that could be a variety of ways: not there physically to take care of their medical and physical needs, or emotionally, not responding to their cries or providing the regulation that babies need so that they can develop their own regulation later on.
Is there a difference in impact between emotional needs and physical needs?
We know that of all of the types of maltreatment, neglect is the most common. So it generally represents about 80% of all cases of maltreatment. But it's also difficult because it's hard to detect. So you don't see the physical scars of neglect like you would other forms of maltreatment. And neglect can also occur in a variety of ways. So there can be physical neglect, so not taking your child to medical appointments or not feeding your child. They could be malnourished, which is going to have a different toll on the child than not talking to a child or not responding to the child. The former having very specific impact on physical growth and also brain development, and then the latter having profound effects on cognitive and emotional development, regardless of whether the physical needs are attended to.
A child who's neglected emotionally, whether the parent's in the room or not, does that rewire their brain?
There is accumulating evidence over the past couple of decades that show that actually yes. So one study that has delineated the negative effects of neglect comes from a longitudinal study on babies who were institutionally reared in Bucharest, Romania. So the investigators included Charles Nelson at Boston Children's Hospital and Harvard Medical, Charles Zena at Tulane, and Nathan Fox at the University of Maryland. And in the early 2000s, they organized a study to create a foster care system in Bucharest, Romania, and randomly select children who were institutionalized, so abandoned at birth, placed in institutions, reared without parents, having rotating caregivers, and very little opportunity to develop an attachment. So children were randomly selected to be placed into foster care, and that led to an opportunity to understand the causal links between neglect and parental responsiveness on all aspects of child development. So from that study, children are now in their late teens. Every domain of development has been studied, including their interpersonal relationships, their cognitive development, emotion development, and even the development of their brain. And overwhelmingly, children show problems in their emotional development, in their cognitive development, and we even see it on the level of their brains. So when you look at the brain functioning of these children, they actually show a reduced amount of brain activity. This is shown very early in life and continues well into the teenage years. And when we look at the structure or the wiring of the brain, they also show a reduction in gray matter, which is the neurons that do a lot of the computation of the brain. And we also see a reduction in the connections between different areas of the brain, showing that there's just differences in the actual wiring of the brain.
Are you talking about 0 to 3 when everything is forming within the human body, or after that?
Because these children were abandoned at birth, they were on average 20 months when they were removed from care, but they varied. Some were as young as 6 months and some were older. And so this was in the first 3 years of life, a period of development that we know there's no other period in life where the brain develops as rapidly. And there's no other period that's as formative. So we really have a chance to understand the causal impact here between what happens early in life and how that affects early brain development, and how that can set a foundation for all development that builds on top of that later.
The parent is physically in the room or in the house with the child, but never interacts emotionally or engages with the child. What effect does that have?
There are different types of neglect. There's the extreme kind that I was just talking about, psychosocial deprivation, reared without parents. But then there are different levels of neglect. So children can be reared in families without having attachment separations, but still not get the emotional input or cognitive input that they need in order for their brain to develop typically. So we know that the brain develops in the context of the environment and it grows in a way that it adapts to the surrounding environment. So if children are reared in environments where they're not getting emotionally responsive, they're not getting the emotional responsiveness they need or the cognitive stimulation they need, then regardless of whether the parent is there or not, that is still going to have a negative effect on brain and behavioral development.
And that lasts throughout life?
There is evidence to show that the quality of the early home environment, so how responsive parents are, how much they talk to children, how organized the home is, that does have a lasting impact on brain functioning. So even when you fast forward until they're 8, 9, 10 years of age, we still see a reduction or atypicalities in how their brain functions.
Do you know why certain parents don't emotionally connect?
So that's an important question. So one is, what is the impact of how parenting or lack thereof affects the brain? But then what is associated with parental risk? And that is a huge question that has been investigated over the years. And there's lots of factors that can contribute to that. There's parents who face extreme addiction or other mental health problems that may compromise their availability. Parents who are extremely stressed to the point where they lack the resources to attend to their child. And this can cut across all cultures, races, economic status. But we know that there are risk factors for parent inavailability. And that's an important part of prevention of the problem.
Let's go into the separation anxiety and the immigration crisis right now. When they're taken forcibly, as they have been in many cases, is that obviously part of the impact? What about the overall impact of the separation?
Based on what we know about development and all of the evidence over the past decades, there's nothing more traumatic to a child than being separated from a parent. And in this case, it's especially traumatic because they're in a new place, they've suffered an arduous journey, and it is absolutely a traumatic separation in that they don't know where they're going, they don't know how long they're going. And we know that these traumatic separations can impact children. So they can impact children in the short term. Children might be more likely to show signs of anxiety or trauma. But then the next question is what happens over the long term if this persists and there's continuing stress. We know that acute and chronic stress can alter stress response systems. Children, for example, might manifest alterations in their stress hormones, increased heart rate, blood pressure, and all of these things over time can have a wear and tear on the body and the brain. So we could see the manifestation of this traumatic separation psychologically by showing increased anxiety or emotion problems, trauma. We can see it cognitively with problems in learning, paying attention, and we can also see it in the level of their brain and biology, so altered stress response systems. And basically, the longer that it happens, the more likely the children are to suffer.
For the parent who is there physically and is there emotionally, how does that impact the child's development?
One thing we do know is that, or one thing that evidence has shown us over the past years is that children go through traumatic separations. Sometimes this happens through foster care. Sometimes this happens through a loss of a parent. And the job of caregivers is to provide them with the responsivity and the therapeutic input that they need. So with the appropriate buffering and care and responsiveness and attention to their needs and trauma and signals, that's going to be very important in helping the children recover. So in the case where a parent takes in a child who maybe has been separated, some of these children go to centers. Some of them may be placed in foster homes afterwards. The more therapeutically responsive caregivers are, the more likely children are going to fare. But the act of separating children traumatically from parents at the border is completely inappropriate and against everything that developmental science has told us in terms of the impact that it can have on children.
If you could talk to parents who have some measure of control over how present they are, how would you explain to them exactly how important that is?
Basically, there's a theory developed from the Center of the Developing Child at Harvard talking about what stress is. And so there are different forms of stress. There's toxic stress. These are things that children cannot handle. Extremely traumatic separations, being reared without caregivers, maltreatment. And then there is tolerable stress. And these are things that children encounter every day. So the first day of school or other stressors related to peers. But the important thing is anything can be toxic if children aren't provided with the right responsiveness. So the message is not that children shouldn't experience stress. It's that the role of the caregiver is to help children navigate the stress and respond to them and help children develop the regulation that they need to develop coping and abilities to surmount any of the tolerable stresses that they may encounter. So I think for the parent that's available, just paying attention to children's needs, responding to their signals, knowing that not every signal is going to be attended to, but the mantra is to be good enough, to be available, pay attention to children's signals, and respond. One of the metaphors that we often give is the serve and return mentality. So the ball, you can think of it as almost a tennis match where the baby serves the ball, and that's a signal. And then the job of the caregiver is to return the serve. And then this facilitates kind of a cycle of interaction where the child's signals are attended to and responded to, which can help children develop, eventually develop the internal regulation that they need to regulate.
How do children that are neglected or have an emotionally non-present parent, how do they manifest in behavior?
There's a variety of ways, and it probably depends on the age of the child, the severity. And so there's no one hallmark system that you would use to identify whether a child's neglected. But signs of not being able to recognize emotions, having trouble expressing emotions, symptoms of anxiety, or difficulty interpersonally are signs that the child is struggling. But children can display distress in a lot of different ways. They may have sleeping problems. They may show certain phobias. They may act out. Or they just may be very withdrawn. So I think it's, and those are the psychological symptoms. And then there's also physical symptoms of just appearing unkempt. So I think there's not one way to recognize symptoms of neglect, but knowing that children may not have the capacity to express that they're being neglected, it's our job to attend to the emotional signals in order to protect them.
Did I leave out anything that you'd like to mention?
I guess there's one study. So one of the most promising. So sometimes. So a lot of the evidence has demonstrated that the longer children face these neglecting or maltreating circumstances, the worse. So the best measure for practitioners and protectors of children is to prevent the problem and intervene early. And so the earlier that effective interventions can be delivered, the more likely children are to recover. So early intervention is best. And the other thing is that even though it may be less likely for children to recover after a certain point of time, there's never a point in life where an intervention wouldn't help a child that's been maltreated. So, for example, children who are extremely neglected, after age 2, it becomes much harder for them to get back on the track towards normality in multiple aspects of their development. Before age 2 seems to be an important developmental milestone. So if we can intervene before age 2, that's great. But that doesn't mean that these children have no chance of recovery. It just means that it may be harder, and the door to recovery may be a little bit harder to open.
Intervening, you mean actually a parent being available or a caregiver?
Yeah, so intervening through, sometimes this warrants removal of the child from a maltreating circumstance, or if the child remains with their family of origin, providing the support so that parents can remediate and respond to their child's signals.